Bristol Hospital is hosting a free monthly geriatric medicine and dementia educational series. And the next session of it will focus on the importance of brain function exercises for people who are suffering from dementia. Now, joining me once again, Dr. Margarita Reyes to talk more about that. Good to see you again, Doctor.
Good to see you.
Yes, I'm curious to learn more about this because we've talked a lot about the different treatments. I've always heard people say, hey, your brain's like a muscle, you got to exercise it. Is that sort of the philosophy we're looking at here?
Yes, it's as important, if not more important, than the medications we currently give for dementia for the treatment. So, as I've said before, if you don't use it, you lose it.
Right. Okay. So, what do you need to do in order to use it? Are there specific exercises that you recommend for patients with dementia?
Yes. So, it has to be a patient-centered approach. Think outside the box and come up with activities that stimulate and interest and engages the person. So apart from doing brain function exercises or word finding exercises, learn a new language or a musical instrument, take a painting, volunteer at a nearby senior center or hospital. So it has to be new, challenging, and fun.
Physiologically, how does that help? Is it just forming new pathways, new neurons, especially if you're trying to learn something new, like you said, a new language?
Yes, so if you use different parts of the brain by doing different or variable activities, then it's more likely to be active and exercised.
Interesting. That's really cool. I've always heard people say, hey, I do a crossword to keep my mind sharp. That seems like that fits the bill, too. What about on the area of caregivers and loved ones? How does that benefit them as well?
If there is a daily routine that keeps the patient busy and active, then there's, of course, more time for caregiver respite. And like I said, being cognitively active delays cognitive and functional decline, and that, of course, benefits both the patient and the caregiver.
Interesting that it can benefit the caregiver in two different ways, including just giving them a break. Okay, the next series happening Wednesday right there at Bristol Hospital from noon to 1. What else are you going to talk about there other than what we talked about right now?
We actually have our speech therapist doing a bulk of the talk. It's usually our speech therapist who develops a cognitive exercise regimen for patients, and so she'll be spending time talking during that series as well.
And there you go. There's a phone number, 845-5901, if you would like to register. Again, it's happening from noon to 1 next Wednesday, the 12th, at Bristol Hospital right there, part of their monthly geriatric medicine and dementia series. Dr. Reyes, good to see you again.
Always a pleasure.
Let's have you back next month.